Thank you for coming. Before we go any further, I'd like to acknowledge the traditional custodians of the land that we're meeting on tonight and pay respect to elders past, present and emerging. For some reason, my camera won't turn on tonight, so you'll just be able to hear my voice, but all the presenters' cameras are working, which is fantastic. We have 5 presenters for you tonight. We have Kate King. Kate is a senior change and engagement leader. We have Damien Goff, who is a podiatrist. Jo Coots, who's the senior manager, integration and partnerships for the Primary Health Network. Peter Mullen, who's a digital health officer for the Primary Health Network. And Jo Deans, who's a team leader for integrated care, also for the Primary Health Network. When we do have a Q&A time, you will be able to turn your camera on and unmute your microphone so that we can make the session as interactive as possible. We will have a poll during the session, so we would love to, for you to take part in that. At the end of the webinar, an evaluation will pop up. So if you can take a minute to fill that in, we'd really like your feedback. I think that's all that you need to hear from me. So I will hand over to, I think Jo Coots is first.
Thank you, Jenny. Could you just move, I think, the next 2 slides? I will also acknowledge that I'm on Camilleri Lens in the Tamworth area and pay my respects to elders past and present. And thank you for coming tonight. And we also will have other people that will join us at a later period online. So I'm just briefly going to run through the welcome and why we're here, and then I'll pass over to Damien, who will talk about what's in it for Allied Health, and then I'll pass through to Peter, who will talk more around the PHN digital support that is offered to practices, and Kate and Jo Dean will talk about the Digital Essentials project in more detail. Obviously, Kim, take your camera off if you've got any questions, just ask or put in the chat. I suppose something that we're interested in is about, what was the motivation for participation in the project. Next slide, please, Jenny. So really, why are we here? Very much digital health is a strategic focus for the PHN. Sorry, that's one too many, Jenny. But really, we just, and some of you may not know who the PHN is, or the Primary Health Networks. So there's 31 across Australia, and we're the Hunter New England Central Coast region. We, broadly speaking, are aligned to our local health districts boundaries, and we procure services or tender out commissioning services for the benefit of the community based on local needs, and also broadly then support the primary healthcare sector, which includes allied health. So thank you. Really, we just recognise that allied health in the digital space is different to other primary care providers. And for instance, some of that might be around the access, the infrastructure and the incentives available to allied health to participate actively in digital health change. And there's also, thank you, some people, as you're watching this, might have already completed your expression of interest. There will be further details if you haven't at the end of this session. So why are we here in a bit more detail? Back in 21, the PHN developed its digital health strategy, and that really helped to collectively as an organisation work in a strategic way to improve the digital capacity across primary healthcare practices. So we had a number of grants that went out in 2022, and that really provided some insights. Much of this work, though, is based around what was done in March 23, where we surveyed the allied health sector to capture the digital maturity. This was also done in the general practice and aged care sectors as well. And so we've got a good picture across the primary care sector in our region around what that digital maturity looks like. So also there was only 80 practices and it was a small sample. It did provide some insights, with the average result being 59.2 of a maturity score, which was quite different to the general practice, which was 71.4 in terms of their overall maturity. So that really has provided the PHN an opportunity to dedicate focus and support in this area. So some of the results, some of was 11 across those 80. So we got a different picture from different practices as well. Most practices participating as well, there were small or solo, so 5 or less employees within their business. Yes, and as mentioned, that really just really acknowledged the need for increased support to allied health practices to increase the digital capabilities, and that's where this project has arisen from. Thank you, Jenny. So sorry, this next slide just provides a little bit more detail. For any practices that may have completed that digital maturity practice results, but this is just a comparison between the average of allied health in comparison to general practice. So there was 2 areas that was new to the allied health assessment, and that was the clinical leadership and the data literacy. So that can't be compared to what was done in the general practice. However, it should be highlighted that there was a strong clinical leadership and desire for change in the digital health arena for allied health practices for those that were surveyed. But the 7 indicators were around infrastructure, which if you can compare that even just graphically, you can see that the infrastructure within allied health practices is lower than general practice. That's probably no surprise. There was also the meaningful use describes the extent to which practices are getting use out of the technology and digital health solutions that they have in place. The readiness, which is a self-readiness score, shows the practice's self-assessed view of the readiness for digital change. The same for the patient readiness, but really is the practice's view of their patient's readiness for digital change. And then there's the digital literacy, shows the practice's view of their employees' digital literacy, and then the data literacy. I'm not sure if we're having some problem with our cameras there. Oh, yep, sorry, there's the survey results. That might have disappeared for a while, so apologies if it did. And as we mentioned, the clinical leadership was the practice's view of that leadership in place to support change, which was quite high in comparison to some other PHNs have done this in different regions, and that was showed that it was quite high for allied health. Thank you, Jenny. The next slide's really just to show, I suppose, when the 3 areas from that maturity assessment and the levels that they were scored in and sentiment and what that might mean if practices were scored within the foundational, intermediate or advanced level. And this is really just, I suppose, a bit of a translation of what it might mean. And there's lots of variability in some of these. And it probably should be pointed out that this future project, the Essentials project, is not desired to get all practices to advanced level. It will be self-directed for the practices as to where they want as a quality improvement project. I mightn't read that out, but I think there's some of the comments that were provided in the survey for each of those levels and from the practices that were surveyed. Next slide, please, Jenny, which I think I'm handing over to Damien, but I might just pause there. If there's anyone online, whether you want a chat or feel free to use a chat. Just introduce yourself in the chat, who you are, the motivation for joining the project, before I hand over to Damien. Or please feel free to put your hand up, turn your camera off and your microphone off. Damien, I will hand to you unless anybody wishes to turn their cameras off.
The bottom left of the screen is the little area where you can raise your hand if anyone has anything they'd like to add. Thanks for asking me to really outline sort of the view from a practitioner's point of view of what digital health might be going forward for allied health practices. Next slide, please, Jenny, is useful. So a quick Google search of, what is digital health, and you'll get a list of things similar to this. There are some specific things to Australia, but they're in my health record. But generally, people's experience of digital health is those kind of video calls that we all had to endure during the pandemic and lockdowns, where actually we saw digital technology in healthcare advance very quickly in a very short period of time. Lots of levers were pushed and pulled at government level to allow us to get further down the road than we would have been. The thing is that digital health is much more than just electronic consultation system. There's a lot more. There are different views of digital health, as whether it's a data-driven thing or a technology-driven thing. But really what this does is, if we can see the next slide, please, it presents us with a massive opportunity now. This is just like a dream, really. And if we could dream of the perfect system and what it might look like in a fully digitally enabled health system, we would have this is my own perspective, but let's say you've got a practice management system and a digitally enabled health service, where perhaps you're going to receive a referral into your practice management software, and that comes electronically and securely from another allied health practitioner or from a GP or a specialist or a hospital discharge. And the client or patient, the consumer's record then is automatically populated with the information from the referral. Now, using that information in the referral, your practice management system may be able to automatically connect into My Health Record and download the health summary and any other information that's in there, such as the pathology, imaging reports, pharmacy, dispensations, all the information that if you've got a My Health Record, and you may have seen yourself, it could drag all that information into your practice management system. It can send out a link to your patient to make an online booking or your client, and also then a link to an online form for your client to complete their own personal information prior to them coming and meeting you for an appointment. And you might even have sort of some warnings highlighted in your system as well. And all this happens electronically, automatically, before you even meet the consumer, the health consumer, and yourself even, because it's not just for us as practitioners, this benefits consumers as well. And the next slide, please, Jenny. This next slide shows how there's a lot of health information out there in varying forms. There's our personal information, so what we know about ourselves. Operational information is stuff like scheduling and billing and electronic medical records, which are held in these practice management systems that many of us have. There's diagnostic information out there, reports, test results, imaging, that sort of thing. There's therapeutic information, these may be e-scripts, treatment plans. There could be drug protocols or surgical procedures and records of them, or radiology, that sort of thing, which is kept separate once again from everything else. There's predictive data out there. Many of us have, smart watches, smart devices, phones that we carry around, and they're, unless your privacy settings are up high, they're constantly monitoring your activity, even things like your heart rate, your pulse oximetry, and in some cases, they can be used to monitor vulnerable people who are in danger of perhaps of falls or wandering. I mean, probably the most common example that we see is in elite sports people, where the footy players all have those little GPS things on the back of their neck, on the back of their shirt, that monitors their activity and is predictive of injuries. And there's some very smart algorithms behind that can predict injuries in players before they happen, and they can pull them in and get them scanned and that kind of thing. So this is the sort of predictive technology which could link back in to our medical record if we allow it to happen. And then there's big data, the public information, the data that's out there, population health, Medicare, PBS stuff. The trouble with all this information is it's not interconnected. There's no interoperability, or very limited, between these different silos of information. Jenny, next slide, please. What we'd love to see, and this is the power, if you like, of digital health, is all this information connected and working together, making it universally accessible, so that we've got all the information when we're looking at improving our health outcomes. The next slide, please. Now, there is a national digital health strategy. There's a lot of money and political will, which has perhaps flown out the back end of the pandemic, where people realised the value of allied health services in primary health care. The first priority or first outcome that they're looking for is that health services are digitally enabled. And there are three aspects to this: that care is connected, and I've cherry-picked some of these. But allied health software integration with My Health Record is something that is underway, and national secure messaging and e-referrals. I'm not sure if you can read the rest of these things, but we want to connect everyone together. We want the workforce to be digitally ready, and we want to enhance, maintain modern and integrated digital solutions. So this is the National Digital Health Strategy, and this feeds very much into this program that the PHN is starting, so that we are ready for the changes that are coming. We're able to upskill, and we know how to make sure our systems are robust and secure. Plus, we're working on common terminology and interoperability standards. That's happening at sort of a pretty high level in the digital health world at the moment, and it's encouraging to see what sort of consultations going on there. It looks good for us. So the PHN Digital Essentials on the next slide, Jenny, is hopefully going to have us prepared for success, that we understand the requirements, and we can develop the right policies and strategies, and make the right decisions about technology and what we want to get involved in, and be leaders in this change, because it's not just over the horizon. It's coming. It's not in the pipeline. It's on its way. It's very much, it's the semi-trailer, it's the road train coming down towards you in the opposite direction, and eventually it's going to happen. It's going to appear. It's going to be here. So we need to be ready for that. The next slide will show how the Australian Digital Health Capability Framework is developed by the Australasian Institute of Digital Health. There's a QR code if you want to look at all of it. But the first aspect of that is digital professionalism. And yeah, the text was very small on this slide. We've tried to squash a bit in, but really it's about us committing to upskilling, to ensuring that we can comply with legislation, professional codes of conduct, policy, ethics, including privacy and security, that we understand the cultural, ethical, and socio-economic aspects of access to digital health and the technology, and also making sure you have an online identity which maintains that professionalism. It reflects your position and standing in your profession, in your community, in your workplace, or your business. So every time you're on social media and you're about to say something, be aware of your online professionalism. And my final slide is, Jenny, please, just about the leadership and advocacy aspects of the digital health capability framework and how it's going to be up to us to lead these changes because they are coming. We need to be ready for them and hopefully be in a position that when our health consumers come to us with an expectation that we're involved, that we can be. Thanks everyone for listening to my ramblings of what's coming. Exciting times ahead, and I think that Peter, now I'm handing over to, is on the digital health team, and he'll be able to tell you a bit more about, I think, what is coming.
Great, thanks, Damien. Jen, if I could get you to just bring up my first slide, please. Thank you. Actually, we might just jump straight over that. That's the one. There we go. Okay, sorry. One more. Thanks, Jen. I do always say technology is designed to make fools of us all. Okay, so what I'd like to do firstly is just introduce myself. My name is Peter Mullen. I'm a digital health officer with the Primary Health Network. I've been with the PHN now about 5 years, a bit over 5 years. Prior to that, I worked in general practice. I managed a general practice in rural New South Wales up in Armidale, and then worked in education and finance before that. During the last 5 years with the PHN, I've helped out a range of general practices and allied health practices and specialist practices look at implementing a range of digital tools, and that's sort of what we do as a team. We're a fairly small team, as you can see there. There's only 3 of us. There's Maz Dixon, who is our manager. There's myself, and then Jack Allison, who is also a digital health officer. We're available to help you out along through the journey, and also I'll just pop into the chat a link to our digital health toolbox, which is the Healthy Together Digital Care Toolbox, which we curate on our website. There's a lot of information there. You'll see, and I think it's got the link there. There's also the allied health page on our webpage. Might get you to jump forward one more slide, Jen, please. So just a quick screenshot of our digital Healthy Together Digital Care Toolbox. You'll see there that when you first go to that page, it'll actually have up there it'll have all audiences in that filter box, but we've actually got a filter there. You can filter off to allied health professionals. So that will then bring up a range of tiles and a range of resources that we curate. We're not really a curator of content as such and we're not aiming to be in our toolbox. What we want to do is provide you with some basic information, but then take you off to some of the best sources of truth to actually access that information. So it might be the Digital Health Agency, it might be Services Australia, Provider Connect, you can see there, and things like that. So there's a lot of links and a lot of information there. The reason we don't curate the content so much ourselves is because it is a fairly rapidly evolving space, and as Damien mentioned, there's a lot happening over the next 12 months in that digital space, particularly with things like the My Health record. The difference between those 2 tiles there, the My Health, is actually the My Health app, so that's where you can look at your own setting up My Health record, and we really encourage people to jump on there, set up their own My Health app on your phone. There's a lot of good information in there, and it is a growing space. Then the My Health record space is, that tile is to set up My Health record access for your business, so you can then view patient records and things like that and see that information. There's a lot of information, as Damien said, that's coming forward in that space. Where the government is moving is to mandatory uploading, so uploading by default rather than by exception. So we're going to see a lot more pathology going up. We're going to see a lot more imaging going up, a lot more discharge summaries and things like that. The record is going to become a more comprehensive record. I will accept sometimes you'll go into a patient's record at the moment and there won't be a lot of information in there, but that will change. And I think that's why it's important and why we've got early on in the information that we provided to you is to get that access to your My Health record, to having that access to My Health record for your patients, set up within your practice, because that space is going to evolve over the coming 12 months. So it's important to get onto that early on. Sometimes also some of that, setting up a Proda account, which provide online digital access, can take a little bit of time. So we encourage you to get into that bit and look at that. The other thing that's happening in the allied health space at the moment is the Digital Health Agency is working with a lot of the major software vendors, and what they're doing is looking at building conformance with those software providers so that you will have that in access to the My Health record through a conformance software, through your hopefully through your clinical software, and that will make that a whole lot easier. But if that doesn't come out, you can still access. You'll see you can access through the National Provider Portal and things like that. So there's a lot of ways you can actually interact with that with the My Health record, and we will provide some more information in phase 2. I'll probably stop there. There's not a lot more that I need to cover, but I might just stop. And if anybody's got any questions, more than happy to take questions at this time. Otherwise, we can move on. If anyone's got questions, they can just pop on their camera and turn on their mic and just ask away, or type them into the question box. No, looks like I'm off the hook, so I'll hand over to Jo.
No problems. Thanks, Pete. Just one thing too, you might notice at the top there's an allied health filter now on the digital health toolbox. So yeah, we've got another some more allied health information being designed. So when you go in and access it, takes out information that's not relevant to allied health. So, and we will be having a new tile coming soon that has specific additional allied health information. So next slide. So today I'm just going to give you a bit of a work through on the digital essentials and what it's all about, and a bit about how it came about, I suppose, is always helpful. A lot of our work is advised by our Allied Health Reference Group, and they really asked us to provide a simple checklist. Allied Health are busy, they need a simple checklist, an easy guide to take them through key education that's really important for allied health and to make sure that they're compliant. There's a lot of information out there and it can be really overwhelming to know where to start, especially when you're running a busy allied health practice. So this really led us to the Digital Essentials project. So we have had input on the project from digital experts and allied health clinicians to just ensure we keep it relevant to you. And we feel like we've sifted through the information that's available and tried to narrow it down and make it really relevant to allied health. So next slide, please. So when we've designed the program, we've designed a self-service model. We understand that practices are very busy. People within a practice might have different levels of digital capability, and different practices might have access to different tools. So we've tried to design the model so practices can work at their own pace. That's why we've called this a self-service model. The self-service pack is designed in a structured way, and it is like a simple checklist sort of style that leads you to the most direct and current resources that are really important at the moment in the digital health space for allied health. This format really enables a practice to work through the program and really design an action plan that suits the individual needs of your practice. So we have divided the improvement phases in 2 sections. So the startup activities will be made available to any practices that have onboarded on the by filling out the expression of interest. And they will be available from this Friday. So if you're interested in joining the project, but you haven't filled out the expression of interest, we will be providing that information following the webinar. The phase 2 of the project are the tailored activities. So these activities are really sort of more in-depth learning activities, really upskilling in particular areas. And these are, can be selected. So you can pick and choose sort of from a pick list on where your digital needs are for individuals in your practice or for the practice as a whole. And again, you can build out your tailored action plan as you work through the program to really design a project plan or digital implementation plan that's really tailored to your practice. There will be group support sessions offered throughout the program, and this is really an opportunity to touch base with Peter and the team at the Digital Health. With myself, I work in the allied health sector, and also importantly, our digital change expert who you'll be hearing from shortly, Kate. I think, building a project and implementation plan is about the process, but the change is all about the people and bringing the people on your journey. So Kate's an expert in the area and will be a really valuable resource as well to answer and guide questions on the change focus of this project. So the project will be starting on Friday. It will be continuing on until the end of March. So we'll have the resources available there. The way that the resource will be provided is in a learning management system, or fondly known as an LMS, if you haven't heard that before. To be open and transparent about our LMS, this is the first time that we have used one. So we have spent a lot of time and effort really building in the resources in there to make sure they're relevant, they're short and sharp, they get you to the information that you need. But along the way, we will be asking you for feedback. You will need a desktop or a laptop to work through the activities. You'll get the better experience. You can use it on your mobile phone, but it probably won't be the best experience. So next slide, please, Jen. Thank you. So when we put together the project and looking at the results of the digital maturity assessment, and advice from our allied health reference group, we've really kept in mind the benefits that we hope to achieve is really increase availability of relevant digital support to allied health and making it easy to access without having to field through loads of information. Our overall goal is to try and increase adoption of digital recommendations and reduce risk of compliance not being met for the requirements, and ultimately advancing digital change and digital capabilities within our region in our allied health sector. For the PHN, obviously there's benefits for us too to be able to develop a tool that's really well informed by allied health, to create a digital toolkit that we continue to enhance as technology changes. And we really want to better understand our allied health cohort and what's important to you. So collaboratively, we can plan for the future. And as Peter and Damien have emphasised, there's a lot of change coming. So we want to be ready on the same page at the same time and offer you the supports that are relevant and that you need. So it's a learning opportunity for us to make sure we're on the same page. Next slide, please. This is just a bit of a roadmap of what we're doing. We've actually been planning way before August, but here we are now on the 1st of October at our first induction section of the Digital Essentials. So we'll have the startup activities open till early November, and then we'll release phase 2 in November, and that's where the tailored activities will start. We'll have these group sessions, as I mentioned before, and these are touch base group sessions, and it's really an opportunity to touch base with our team, let them know how you're tracking, ask questions, connect with other allied health professionals who are also undertaking the self-service module. So that will also be in February as well. So the other part of this project is for us to really deliver education in the digital space. So rather than us designing the education without consulting you, we've sort of got a range of topics, and they cross over into digital and business topics. So we wanted those, we wanted to get some feedback. So Jenny's just going to launch a poll for us on the key topics of education. And you should be able to vote on this poll. And when you consider your voting, if you just like to select the topics that you feel are, you know, if we ran a session on this topic, you would really like to attend. So we will plan to seek out experts in these areas and to provide these educations based on your voting. So if you want to go into that poll, hopefully you should see it. And if you can place your votes over the topics that you really are interested in and you'd like to see education delivered on in the future. So we'd probably aim to deliver those education pieces in February, March next year as well. So we've got anyone else wanting to put some votes into those topics? Okay. And Jenny, is there additional poll there that needs to go up as well?
Yes.
I'll hand over to you to run that.
So, yeah, they're just the results from the first one.
Okay.
So, sounds like everyone's fairly keen for everything, which is fantastic. I'll just share the next one. We just couldn't fit all the choices into the first poll, so I created two.
So the other ones, they're financial management, business management that aren't traditionally digital, but we do have opportunities for experts in this area that we can connect with to deliver this sort of education if it's something that practices are interested in. Is anyone having any trouble voting? You want to put a message in the chat? Or... Yes, and as mentioned before, there is an option to put any other ideas that you have in the evaluation that will be provided at the end. Okay, we're ready to hand on to the next speaker. Has anyone got any questions that they would like to pose in the chat about the program so far? We have had someone say in the chat, Jenny, that they can't seem to vote. So is there instructions on how to do that?
Well, the poll's actually closed now, so
okay. We're maybe if in the evaluation, Kim, if you just put in your preferences, that'd be great. Thank you. And I'll just hand over to Kate King, our change manager, who will cover off the other phases of the project.
Thanks, everyone. Hope you're having a lovely evening. Thanks for being with us tonight. I've done some wild things to kick us off in both the chat and the question set. One, I popped a message in the chat for everybody online to tell us who you are, what practice you're representing, and what brings you to be part of the Digital Essentials program. As Jenny noted later on, please reply in the question set. And so I went into the question set and I can see Susan has replied. So thanks for your advice, Susan. I then replied back to you with the same question. As you can see, digital capability is a learning exercise for all of us. And as you've heard tonight, it's about being able to maneuver through those changes together in a proactive way. So I just want to take a pause before we go into some of the program resources, just to give you the opportunity to provide that advice to us, who you are, what practice you represent, and what brings you here tonight. And you can do that in a number of ways because we all learn differently and we all like to engage differently. So you can either take your microphone off mute and put your camera on and introduce yourself to the team. You can take the opportunity to either reply in the questions or the chat, which function's working for you. Or if you're savvy and you'd like to use the reaction button down on the bottom left-hand corner of the screen, I'd love to see what emoji you want to post. So I'll just give you a few moments to tell us a little bit about yourself so that we can make sure that we're connecting with you in a digital way that suits you. So I can see some thumbs up and some smileys. Thank you for that. What else have you got? Susan, thank you. Another thumbs up. Andrew, she's popped up a hand. Thank you very much. Would anybody like to take themselves off mute or pop their camera on to introduce themselves to the group tonight? Thanks, Veronica. I'll let that keep happening. Please interject if you want to take the opportunity to tell us about yourself. But it's just one small representation of how we can continue to grow together and support each other through these wonderful opportunities. As you've heard from the previous presenters tonight, digital maturity and digital advancement is extremely important to all of our businesses. And as a small business owner myself, I'm really excited to be here to help Allied Health do this in an easy, proactive, self-paced way. As Joe outlined in the previous slides, we've really lent into what we've seen, heard and listened to in regards to where Allied Health needs support digitally and how we can put packages together that are simple and self-paced in this way. My job tonight is to show you some of those resources that we've popped together. And the first one I'm going to start with is just taking a quick look at the LMS system. We won't release the links to participants until Friday. And as Joe mentioned before, we'd really love you to register for the program so that we can support you in a proactive and healthy way as we move forward. Tonight, when I show you through the LMS, we're going to look at phase 1. So they're the startup activities. And if you've got feedback on the things that I show you tonight, please feel free to jump in. We'd love to answer your questions and support you at this earliest stage. What I will show you is some templates that we have created for you. And 2 of the key activities that are a part of startup are about change management, which is my expertise in business, and putting people at the centre of all digital change. And Peter and I will also walk you through some journey map workflows, which will help you baseline who you are digitally in your practice and how we can help you build the gap between current state and potential improvements that align with some optimal digital workflows that the PHN have developed. So I'm just going to share my screen to start off with so that you can have a little look at the LMS. We'll just show you a small component of the LMS tonight. I can see that you can see one tile on your screen. As Joe mentioned, this is the first cab off the rank using this platform for PHN. As new modules develop, you will see these become available. We're looking to utilise this service for the Digital Essentials program. And I just want to show you the simplicity of using this platform. So once you're logged in, you will receive a tile. For me, it says review course because I've been in here a couple of times. For yourselves, when you come in for the first time, it will say Start Course. If we click onto that, you will receive this package of work and some guiding information. If we click through, and I just want to show you the simplicity of how it works, it will load in, and I'm just going to restart, and it will give you a flow of information of screens that pertain to this first phase, startup. If we were to start the course, it will flow you through support information to get you from A to B. And we will keep this as simple as possible. We want to let you know that Startup will have 13 key activities for practices to complete before we release phase 2, which will be around what your essential digital activities will be that are tailored to your practice. Not everybody's the same, and everybody's on a different journey when it comes to digital improvement. So we want to give you the good foundation of these startup activities to ensure that you are connected with PHN and the key foundations of digital improvement so that you can create your own tailored plans to move through the rest of the program together. In phase 1, that will guide you to that tailored activity. And what we're suggesting is the 13 key activities are completed within the first month of receiving access to the LMS. Reason being is we want to give you as a big of an advantage to complete your baseline and then work through developing your improvements with your teams at practice. As I click through here, I want to show you what these first 13 activities are and walk you through those. The first one here will provide you an editable template that you can download and track your own progress. As you move through each of the key activities in the LMS, it will provide you detailed support for each of these 13. But let me show you what these 13 activities are. This is the downloadable template that you can use to track your progress. It will give you advice on each of the key activities and the ability to jump in there and provide your progress notes. As you can see, the top 2 activities have been pre-filled just as examples for you. So, first one's first, attend the induction session. Tick, you're already here, friends. Key activity has been completed. Secondary activity is to provide an update about the program and the things that we've provided you tonight and shared with you so that the people in your team can be onboarded into the opportunity of the program. Now, once we release the LMS, this recording will be available for you to share. You might like to organise a morning tea or a team meeting to provide a quick update in regards to what opportunities are available and what support PHN are providing. As you move through the following activities, these are quite high level, and as I mentioned, in the LMS system, there will be further details and support material that will help you move through each activity. You might need to create a digital working group at your practice. If you're a practice of 1, you may be the digital working group. However, if you're a larger practice, you might like to get together with your team and work out who is the right people to be on the team to move your digital activities forward. You might need to check your internet access, create a storage location so you can progress your digital improvement activities. And as we move through the following activities, we want you to stay connected, have advantage of regular resources, events, education, learning opportunities. And if your practice, as it outlines here in step 9, took the opportunity to complete the digital maturity assessment in 2023 with PHN, you might want to request your results to help you develop your future plans. If you didn't participate in that activity, there's no problems at all. You're starting at this baseline and we will provide you all guidance that you need to move through to further digital improvements. As Joe Coots mentioned before, this program isn't designed for everyone to become an expert in digital improvement, but we do want to see supportive activities moving forward so that you can plan for your future as well. The following two activities I'm going to give you further details on tonight: change management principles and tools, and as I mentioned before, creating your digital workflows. It's a really good practice to understand that through change, people need to be considered, and how we consider them and plan for those key changes is something I will showcase for you. With the digital current and future states, Peter and I will show you through some optimal workflows, and then I'll show you the pack in regards to how you can be supported using some templates. When it comes to personal My Health Record app and register for My Health Record, there's some preparation activities before your practice might be ready to go with those two programs. We'll provide you some general advice in the LMS. However, if you need support throughout any of these startup activities, you will have the connection to the Digital Essentials team and also the Digital Help team at the PHN. We're available to be contacted anytime you need. So before I go into change management and the key activity in 11 with your digital mapping, I just want to pause. Are there any questions from anybody about the LMS or about the key checklists for stage 1? I'll just check the chat. Would you like me to step you through either of those products again? Please raise a thumbs up in the reactions or a thumbs down. Thumbs up, you'd like more advice. Thumbs down, you're happy to move on. Thanks, Susan. Thanks, Kelly. Thanks, Sophie. Okay, 3 thumbs down. I think we'll continue to move on. However, if you've got any questions that come to mind, please feel free to re-engage us in the questions or the chat. Jenny, could you please pop up the presentation again for me? Thank you very much. Okay, just moving on to the next slide. Let's talk just a few more slides along, please, Jen. To change management. Thank you. Let's have a quick conversation about change management. It is how we communicate what we often overlook in projects. So that could be any kind of change that we make. If we introduce new policies or procedures, new ways of working, new digital infrastructure, we need to consider how we bring our people on board. And the easiest way that we can do that is to do some basic assessment work. It's about communication and engagement on moving people from A to B. And what the most simple way to move people through these steps is to understand, what does the success of the change look like? Why are we changing? So what's the purpose? How do we explain that to our patients or our referring officers or even our staff members? How do we bring them along that change journey? What is changing? What will it look like afterwards? And for people, what do we need to do to support them through change? Often in project release, we think about, oh, a new system is going to fix everything. But unless we train people, communicate with people, understand where people need support to move from, let's say an example as a paper base, to utilising a digital system, we won't know unless we unpack the change component. So in the startup activity for change management, we've created a very simple step-through pack and supporting information for you to understand change first, educate yourself on change, and then as you move through phase 2, consider using some of the templates that are available. I'm just going to show that pack for you now so that you can get a understanding of what kind of material and support we will be providing as part of the LMS links and part of startup through to phase 2 in your tailored activities. Just bringing up that screen now. So as you can see, we will provide you advice on change management. We will give you the grassroots about what change management actually is and some detailed links for some recommended change organisations to unpack change further in regards to people on the journey. We will provide further advice on what to do about change and how to move through change so that you can receive and give the benefits of moving from A to B. Some of these key benefits include improving communications and engagement, understanding who the people are that will be impacted by the change. And that might range from, as I mentioned, your staff members through to your patients and also your relationship with your GPs, but also your connection and the digital support that you can receive from PHN. It will increase the adoption of something that you utilise or introduce. It will also introduce the idea of minimising disruption and helping you achieve your short and long-term business goals. It's by research, change management introduction and influence can actually reduce impact by about 60% if you work through simple approaches like the ADKAR model, building awareness and desire about things that you want to change, building knowledge on how that change is going to take place, giving people the opportunity to have the ability to demonstrate the skills that they're learning or the new behaviours that might require change. Often, for me, I find people say, oh, I don't want to go through the change. However, I want it to be the result of the change. So bringing them on the journey is really important and reinforcing that change so that it becomes the norm. Now, I just noticed that somebody had their hand up. Anne, would you like to ask a question?
I'm just wondering, can you hear me okay?
I sure can.
Okay. I'm just wondering, with those changes, I have my records digitally, but obviously there's a whole mountain there, how that will transpose into a newer method, because then it seems to be like I'm concerned that will be another whole load of work. Does that make sense?
Yeah, can I just qualify your advice? You've currently got digital records?
Yes, they're computerised records.
Yeah, so you use a practice management system, is that fair to say?
I'm a sole practitioner, and the records that I have are computerised, and I just keep all my notes, but they're in a format that I developed myself years ago. So I'm just wondering how those two things will gel.
Yeah, and it's a fair question and it's a fair concern. This project is not aimed at making you change what you do currently. What we do want to support you with is ideas and methodologies that you can consider in regards to compliance and utilising tools and systems and services that are available that suit your needs. I might bring Peter Mullen online just to talk to you about the digital support that the team can provide as we move forward to help you make those assessments, Anne.
Okay, thank you.
That's okay. Pete.
Hi, I'm back. Look, I think it's like any change process, and I can understand and appreciate your concern that it appears to be a huge undertaking. But I suppose the other way to look at it is, it's that old axiom: how do you eat an elephant? One bite at a time. So measure what you need to be doing. Have a look at it, see what are the steps that you can do reasonably with the resources that you've got, with the time that you've got, and what's going to give you also, I think, probably the biggest bang for the buck. And I think that's probably the way to approach it. I know that sounds really generic. We're here to help you along that way. I'm not, there are some things that we can help with. There are others that obviously we can't. That comes down to a resourcing issue. But I think that's probably the way to look at it, is to say, okay, what am I trying to achieve, and how can I best achieve that? As I say, we're happy to support you where we can. But yeah, look, and that might be a discussion we need to have maybe offline. But yeah, happy to support you where we can with the different resources that we've got. So.
Okay, thank you. It might become clearer to me when the more that I start looking at what's in the training.
Yep. Were you, just to clarify, have you got both older records that are paper based as well as electronic records?
Yeah, I do keep some paper records, but then I have computerized the majority of.
Yep. Okay.
Yeah.
Cool. Yep.
But I utilize them both.
Yeah. Yep.
I love these questions. Keep them coming, friends. This is what this session is all about. It's giving you the opportunity to understand where we are at a starting point to provide you that guidance and help you determine the best path for improvement in a digital sense. And thank you so much. I really appreciate you engaging, and thanks, Pete, for your support on that answer. We're definitely here to help you unpack what the right approaches are towards digital maturity as we move through this. And Anne, I think you're right. Once you have the information at hand and access to the LMS, you'll be able to see further details about how we can support you, and it probably will promote a number of other questions. That's the beauty of change. As we move through any relative choice to make a difference, it really does have to be right time, right size, right place. This is the advantage of us giving it to you in a simple format, in a step through way that can help you gain the best advantage that you choose. As we move back into understanding change management, it's a really great segue. We really do want you to feel comfortable moving through these packs, and so they will have editable templates that will help you determine the right way you want to make your change roadmaps. They will help you unpack those digital changes in a way that will help you size change right and at a time that suits your business. we're all busy people. Day jobs get in the road when it comes to investing more advice and more experience in digital landscapes. So we want to try and give you the simplistic way of putting change down on paper and then making some educated decisions on what you do next. So these will provide you relatively simple templates. If you need support and advice as we move through, please feel free to reach out to the team. So this pack itself will be available in the startup activities, and as Jo mentioned before, we'll release those by the end of the week. As we move into the final component, I'm just going to stop sharing. Is there any other questions about change management or any of the information that we have presented tonight that comes to mind for participants online? Lovely. Jenny, I might get you to pop the presentation back up, and we'll move through to the journey map component of the slide deck, please. Just a slide back if you don't mind, Jen. One more back if you don't mind. Thank you. Over the course of creating this checklist and guides to provide allied health with a good digital advantage, PHN have developed an optimal digital flow to give you a relative baseline to work from. And Peter, I'm going to call you back in if you don't mind. I'd love you to walk through some of these steps that we've got up on the screen here.
Yep, no problem. Jen, I might get you to go back actually one more slide if you wouldn't mind. Excellent. Alrighty. So what we've done is we've looked to develop an optimal digital workflow for allied health referrals. Now, this is in, sometimes in a perfect world, it's not going to be necessarily replicable for everybody, and particularly initially, early on, initially, but, I think it's something to work towards. What we've done is looked at it from two aspects. The first one here on this slide, we've broken it down. You'll see it when you get this. It's a full-page document, but we broke it down into two. So the first part is a referral that's coming through from another health professional, whether that be another allied health professional, a specialist, a GP. We do mention in here, obviously, that the patient would attend that appointment with them. If they're seeing a GP, they may do a GPMP or a GP chronic disease management plan or a mental health care plan, depending on the referral that's being made. I will make the note that I think most people are probably aware that there was some changes that were going to come through on the 1st of November to things like team care arrangements and GPMPs. They've now been pushed back to July next year, so we don't know any more detail on that. So we're sort of proceeding on the basis that TCAs and GPMPs will stay in place at least until July next year. But as that changes, we may need to look at this workflow, obviously. So the referrer makes that referral. We would hope that referral is sent securely using something like secure messaging or an e-referral solution. It's received then into the receiver's clinical solution, into your clinical information system. It's reviewed by the allied health professional, and then the advice, back to the referrer, whether if it's a GP taking part in the team care arrangement, a TCA, that advice goes back securely. Any patient data communications, we would be very much encouraging you to look at something that is secure. As I said, mentioned, there's a number of secure messaging providers out there and a few e-referral solutions. I'm going to state straight up, email is not a secure method of transferring patient data, but we can cover that in more detail down the track. The allied health clinician then would contact the patient. That might be by phone or email, and then they would schedule an appointment. Now that might be done through an app or something like that. Jen, can I get you to jump on to the next slide if you wouldn't mind? So again, this is where the self-referral comes into it. So again, the patient self-refers to the allied health professional. They're contacted by the allied health professional. They might provide an online booking appointment through an app or something like that. The patient then schedules their appointment. Communication goes out to remind them about that, and this is where the two journeys meet, obviously. And then, digital calendar, so it might be to put it into their calendar, so they might go to Outlook or whatever, Google Calendar, whatever they're using. A reminder then goes out prior to that to communicate, remind the patient, because obviously we're trying to minimise those no-shows and things like that and make sure patients attend. And then we've got that initial attendance by the patient, where you might look at their My Health record, obtain that personal information. Again, they might have had a hospital journey, so there might be a discharge summary in there, or you might need to look at what their current medicine regime are, because patients, again, most of that prescription and dispense information is there in most patients' My Health record. And then you've got your next step. So it might be reschedule a future appointment. You might share case conferencing via a telehealth, a secure telehealth platform. You might provide some information back to the referrer, give them a mid-care report or a end of the care episode report. So there's all sorts of things that might come into it. And then depending on your access to the My Health record, if you've got conformance software, you might upload something like an event summary. So it's closing off that thing, that care episode, and then putting that information back into the My Health record for other health professionals to be able to access that information. And again, it may also involve communication back to the referrer via a secure method to give them, again, that detail about the end of care, the end of the care episode. So there's a lot of steps in there. I acknowledge that, and some of them you may be doing. There's a few that may be new to you. There's a few that may be difficult to get your head around initially, but we're more than happy, again, and I think as Kate mentioned, that we'll support you through that journey. There's a lot of information out there that you can access and get information on, things like secure messaging or the different apps that are available and things like that, and the My Health record access and all that sort of stuff as well. So that's pretty much that patient journey, and I've covered a lot there very quickly. When you get the access to this information, just take your time, work through it, and that will give you a version that's editable, so you'll be able to actually put in where you're up to, where you need to go to, and some information on that as well. That might be it for me on that. Where's our next slide? And I don't know who I'm handing back to now. Kate.
It's me. Thanks, Peter. Just briefly, I want to just iterate that we have a support pack that will be in the LMS specifically about your journey and creating your journey. As Peter mentioned, that's the optimal digital workflow that PHN recognise for those referral options, whether it be from your professional health service or self-referral from your patients. What the activity will do in the startup with you is baseline who you currently are now and give you the opportunity to reflect on that optimal digital workflow so that you can think about what improvements might suit your business, what you're capable of achieving now to step forward to that optimal workflow over a progressive amount of time. So I'll just quickly show you some of the templates that will be in that pack. And if you have any feedback on them, please feel free to shoot a hand up or jump off mute or pop something in the chat. I just want to show you what we're creating to help you through this journey. So it will give you some advice about why journey maps or workflows are beneficial to help you with your improvements. It will give you some advice on the activity itself and step you through how you can review the workflow Pete has just walked you through in more detail. and then create your own current state, and then compare your current state to future state. What this will do is give you a good baseline to step you through to creating your own tailored digital action plan that suits your practice. We will provide you a wealth of support material in phase 2. You might find that out of that wealth of material, your outcomes from this activity, as well as other considerations for business improvement, may only need a subset of the activities that we provide. So it's really giving you a good, healthy guide on how you can make digital improvements that make sense. In our pack, we will provide you the workflow and links to be able to digest this information that is the optimal flow through that we have there. And then, as Pete mentioned, we'll also give you editable templates that help you unpack your practice activities. This one's a example that we've popped through that align to each of those steps. So GPs might phone or fax practices. Records from the GPs might be handwritten or, as mentioned before, some digital, some still in paper form. And it will flow you through just thinking about where your current state's at. None of it's wrong. None of it's perfect, or it might be perfect, and you might find some surprises that you're aligning quite strongly with the optimal workflow. And your action plan may only be small or progressive. Some practices might find that this advice and their download needs a lot of digital attention. We'll provide you a good range of support material to help you make those decisions. After you've completed this component of the activity, we're suggesting that you then write yourself an improvements list. And this will also be an editable template that we will provide you in the LMS. So that concludes our advice on the LMS that will be provided at the end of this week, as mentioned before. Jenny, we might pop through to the next steps slide, if you don't mind.
Is it that one, Kate?
I can't see the screen being displayed there.
Sorry.
That's okay. Excellent. Can everybody see that screen okay? If not, just pop a reaction in and we'll redisplay that there. Beautiful. I love a couple of thumbs up. Thanks, friends. So what happens from here? We've mentioned it a couple of times. We really would love those that are considering being part of the program to complete the registration process. It originally was delivered as part of the EOI, and we will send out that link again. For those that have already completed the EOI, you are considered registered. Thank you so much. We hope that we can support you through this journey through the end of this year and into March next year. From the 4th, we will provide you access to the LMS. It will have phase 1 available for those activities to be completed in the next 4 weeks. However, if you struggle, if you need more advice, if you need help, reach out. That's what the program team is here to do. As we move through from phase 1, the phase 2 activities are all of the tailored information that help you develop your own practice action plan to help you digitally improve. We're aiming to have that phase in the LMS from November, and we will then help you through key activities that will be pre-engaged group sessions. That's why we asked you to provide some advice on what education you would love to see us prepare for you. And they will also have the opportunity for you to come together as a group and check in on how you're progressing with your digital improvement plans, ask questions, gain support, and help each other develop in this space as you move forward. Connection and relationship, I find, is one of the greatest advantages with these types of opportunities from organisations. So get on board and get involved. And for the program itself, we'll really be looking to hear from you more about your experience, what feedback you can give us about the program, the resources, the support material. So we're really looking forward to working with you throughout this period and into 2025 in all of those key areas. I'm mindful of time. We've got about 10 minutes left of this session tonight. This is the opportunity for any participant online tonight to provide us any advice or ask any questions before we move into closing. So if anything has come to mind, please feel free to let us know now. Silence is golden. That means you're all ready and raring to go. Let's Go Digital Essentials program. Really appreciate you being here. Peter, do you have any closing words or comments?
No, I don't think I've really got much to add. I think everybody's probably looking at it going, what have I signed myself up to? But I think it's an exciting project, and I think there's a lot of benefit for the practices that get involved. So I'd really encourage everybody to register and join up.
Peter, Joe, Kate, do you really have any kind of estimate of the time commitment that's going to be involved to complete this 13 steps in 4 weeks? What do you think we should set aside as a decent sort of amount of time to complete the tasks?
That's a great question, Damien, and I'm sure it's on everybody's mind. It is a relatively achievable to complete in the 4 weeks. What I am going to suggest is the first 9 activities are making sure you're connected with the people that are on the screen, making sure you're favoriting and visiting digital resources that are already available online, creating some storage or digital space at your practice for these materials. They're quick and easy and achievable digital activities to get you started. As you move through to the 2 key packs that we provided advice on tonight, change management, it's an education piece at startup, and the digital journey is where you will get your best advantage and spend the majority of your time for startup, as well as My Health Record. And Pete, I might just throw over to you in regards to some of that preparation activity that teams might need to do and what kind of time investment those activities might take.
Yeah, it's probably hard to estimate the time because it's going to depend on business structures and things like that, and whether people are sole practitioners or whether they're part of a corporate practice or. So it's a little bit hard because some of those activities, like signing up for a Prader account or provider digital access account, can depend on what your business structure is. But I think that they are, in the main, they're quite achievable. It just takes that little bit of time to allocate to it, get your head around what it is that they're asking. The registration process is relatively straightforward, and I think it really, but it might take an hour to do the reading and then do the application. But most of the applications you can do step by step. You don't have to do it all at once. And there, there's some videos on the Digital Health Agency website that will take you through, how to actually do each step and things like that. So there's some really good support materials in there as well. So yeah, it depends on. It's really hard to put a time frame around it, but I think that's the part to do. The other part, people again setting themselves up so they've got access to the My Health app for their own My Health record. There's a great video on the Digital Health Agency website that you can watch. It takes you through that process step by step. You can just pause that, do what you need to do. And it really is, it's not a long process. It's just downloading the app. You've got to set up you've got to log in, make sure you've logged into your own My Health record via your MyGov, but you can do that as you go through the video, do that bit. So if you've got access to that information, you've got your passwords and everything and your second factor authentication set up, you can step through that and you can have that done, maybe 10 minutes. So I think it does sound a lot, but once you've got those tools there, you can just chunk your way through them and just do it step by step.
Can I just add to that, the beauty of the LMS as well is that you can just come in and out as you please, and a bit like Netflix, it picks up where you left off. So if you do find yourself with 15 minutes to spare, you can, pop in and just spend 15 minutes in there navigating some work, and then, get out of it. And then if you can't get back to it till a couple of days, it will really pick up where you left off as well. So I think that's also good, so you can chunk it down like Peter was saying.
I think also the bit that I would add, if you've got a team available, this isn't a journey just for you. This is a team journey, and you've got to involve everyone in the practice. So I think if you've got that opportunity within your practice to leverage off other team members and colleagues, don't be shy in doing it.
Great point to finish on, Pete. Yeah, we want to make this as simple as possible. I think that's the end game for us. Jenny, I might hand over to you to finalise our session.
Thanks everybody for coming tonight. Don't forget to fill in your evaluation, which will pop up automatically at the end. This session has been recorded and will be uploaded onto our events calendar on the website, not the calendar, the library. So it should be up within about 24 hours, and we'll also have a PDF copy of the slides there as well. I think that's all that you need to hear from me. Thank you all for coming, and we'll see you next time.